When there's a diagnosis of autism, what's next? Some early signs of autism include lack of or delay in spoken language, repetitive use of language, which is called echolalia, little or no eye contact, lack of interest in other children, lack of spontaneous or make-believe play, persistent fixation on parts of objects, poor response to his or her name, fails to imitate caregivers, motor mannerisms such as hand flapping, fails to point or show joint attention. How is autism diagnosed? Because there are no physiological markers, laboratory tests will not diagnose autism. Instead, much like diagnosing attention deficit disorder or ADHD, interviews, questionnaires, and some standardized assessments are used. Oftentimes, it is basically parent report and sometimes teacher report that helps to lead to a diagnosis of autism. You may want to check out the following links. The YouTube link, www.youtube.com/watch V equal capital S, lowercase x, 0, lowercase x n b, capital P, capital G, lowercase k, capital D, lowercase k. You can also go to the Autism Institute in the College of Medicine at Florida State University. Just type in Florida State University Autism Institute and it will take you there. Your child, your sibling, a friend has just received a diagnosis of autism. Some are shocked, but for many others it is the confirmation of their fears. Years ago, there was very little information or help available for parents who wanted to do everything they could do to make sure their precious child could live a full, happy, and productive life. While the first reaction to such a diagnosis may be fear and despair, there is hope and help. The causes. The Cambridge Center for Behavioral Studies says autism spectrum disorder is now considered to be neurobiological in origin. At the present time, there are no genetic, neurological, or other physical markers that can be used to distinguish a person with autism from persons with similar behavioral characteristics. Instead, the diagnosis of autism is applied to persons who meet specific behavioral criteria. Noticeable characteristics should be evident before the age of 3. Why is autism a spectrum disorder? Autism is considered a spectrum disorder because the degree of impairment in the behavioral categories of social interactions, verbal and nonverbal communication, play behavior, restricted, repetitive, and stereotype patterns of behavior, and resistance to changes in routine varies very widely among the diagnostic categories and for each individual. Just as each personality is unique, so too are the characteristics of each individual with a diagnosis of autism. What is the next step? No doubt parents will receive a great deal of good advice about treatment options, but they must be wary of treatments that have no evidence of being helpful and may in fact be harmful. Over time, parents will probably decide on a team of therapists for their child. Occupational therapists, speech therapists, physical therapists, and so forth. Each will work to help the child achieve goals in their specific fields. According to the Cambridge Center for Behavioral Studies, it is now known that early intensive behavioral programs can eliminate completely the symptoms of autism in some children and greatly improve the lives of many others. While there is no cure for autism, applied behavior analysis is a proven therapy that enables those diagnosed with autism spectrum disorder and their loved ones to obtain and enjoy a higher quality of life. Applied behavior analysis is a very individualized treatment approach in which the behavior analyst takes detailed measurements of current skills and behaviors and designs a behavior plan to increase current skills or build skills that are not present and reduce or eliminate maladaptive or unwanted behaviors. Skills in communication, social interaction, self-care, and academics are addressed, as well as others. Behavior methods are individualized for each learner. A closer look at evidence-based treatments. The Lindgren and Dubé 2011 study researched treatments that had strong scientific evidence of efficacy. The researchers relied on data obtained from 5 primary sources of consensus judgments about ASD treatments: the American Academy of Pediatrics Council on Children with Disabilities, the National Autism Center, the Association for Science in Autism Treatment, the National Professional Development Center on Autism Spectrum Disorders, the detailed 2005 review of ASD interventions completed by Simpson and his colleagues. The results. Interventions supported by significant scientific evidence include the following: applied behavior analysis, discrete trial training, functional communication training, pivotal response training, antecedent-based interventions, early intensive interventions, this is birth through 3 years, social skills training, and more. All of the interventions named here are used in applied behavior analysis. Interventions that are not recommended: holding therapy, secretin, chelation for neurotoxicity. Unfortunately, there are charlatans out there pushing treatments with no scientific basis or support to those desperate to do anything to help their child. Some of these so-called treatments can also be very dangerous. How to select a behavior analyst. Many people claiming to use behavior analysis do not have the training or experience necessary to design and implement ABA therapy. Some states do not have rigid guidelines regulating the use of the title behavior analyst, but things are changing. Defining features of the ABA programs are directed by professionals with advanced formal training in behavior analysis, at least a master's degree, as well as supervised experience in designing and implementing ABA programming for learners with autism and related disorders. Met the educational, experiential, and examination performance standards of the Behavior Analyst Certification Board and are board certified behavior analysts, BCBAs, or can document that they have at least the equivalent training and experience. They adhere to the BACB's guidelines for responsible conduct and base treatment on the best available scientific evidence. Where can you find behavior analysts in your area? First, conduct an internet search for companies in your area that advertise ABA therapy. Then, check the credentials of those BCBAs on staff. Let's go to the Behavior Analyst Certification Board. The Behavior Analyst Certification Board, this is the credentialing body of behavior analysts. First, go to bacb.com. Then click on Find a Certificate. You can plug in your zip code, city, state, or the last name of a therapist. Then click Search. You will obtain a list of BCABAs and BCBAs within that search criteria. From there, you can actually click on the behavior analyst's name and send him or her an email. Autism Speaks has a wide variety of resources for parents looking for support to help their child just diagnosed with autism, and not just children alone, to help your teenager transition into adulthood, to promote independence of your adult children diagnosed with autism. Please check it out here at this web link. Some toolkits include special needs financial planning, safety, school, technology, health and wellness, behavior challenges, medical resources, transition to adulthood, and much more. What does ABA therapy look like? Please check out this wonderful YouTube video that shows you some of the typical approaches behavior analysts use to help your child with a variety of skill deficits, such as brushing teeth, bathing, toileting, spelling, attention to detail, focusing on a particular assignment for a greater and greater period of time, and much more. Thank you for listening. Over the course of the next few weeks, we will be focusing on treatment approaches for those diagnosed with autism. I hope you will join me. Until next time, have a wonderful week.